My name's Ted Chapman. I've been a patient here at Harborside Health for a little over a year. I'm a patient here because I have brain cancer. I have a mixed grade 2, grade 3 astrocytoma. It's a very invasive form of brain cancer that does not respond generally very well to surgical removal. Following my diagnosis, I was told my tumor couldn't really be removed safely, and I began the standard course of treatment. And what I discovered in my first month of chemotherapy was that I had a life-threatening allergy to the drug Zofran, which is the primary anti-nausea medication provided for chemotherapy patients. When they gave it to me, it essentially shut down my liver. And I went through the next 10 months of chemotherapy with essentially no protection from nausea. And for those who aren't aware, the main drug that is used to treat brain tumors is an oral capsule drug. And so if you think about it, not only do you have to take capsules when you're feeling nauseous and keep them down, but you have to keep them down long enough for the chemotherapy to take effect. My regular experience taking my chemotherapy would be I would vomit violently for half an hour. Then I would have to get the will together to swallow these capsules. And then I would feel sick for 3-4 hours, and then I would vomit violently again from the actual effects of the chemotherapy. It tore up my stomach lining. All the vomiting eventually really starts to wreak havoc with your whole system. And I was miserable. I also was told at the end of that period that my tumor was growing and that I was going to die within weeks or months. And just by luck, I did not die. And everything was stable until a year ago this week when I was diagnosed with a recurrence. Happily, I'm living out here in California now. And so I sat down with my oncologist before we started the treatment plan, and I told her, look, we know that I have an issue with antiemetics, anti-nausea drugs, and I've had a pretty bad experience. And my plan is to take whatever you do give me, because maybe it'll work, and use cannabis. And my oncologist said something that is never going to leave my brain, which is hospital policy prevents me from suggesting you do that or approving it. But I personally wholeheartedly endorse that decision. And by the way, many of my patients who are using cannabis use it this way, and she gave me instructions about how it's been effective. I followed that advice, and I went through 9 months of chemotherapy until I had another recurrence and had to stop that treatment. And I'm actually starting an experimental treatment right now. But I had 9 months of chemotherapy in which I didn't vomit, as opposed to a year of chemotherapy back in Hong Kong where I vomited multiple times every day. To say that it was a positive change in my quality of life is just the biggest understatement there could ever be. I'd like to be very upfront about these things because I think it's important to bring it out of the closet, to bring it into the public space, and to treat cannabis like medicine, because that's what it is. So I went and met with my HR department, and before signing the most recent year's employee agreement, I sat down and said that, there is one item here that I feel uncomfortable signing on, and it is that I state I will not use any drugs that are considered illegal. And I asked them, what about, I'm in California. In California, my use of cannabis is legal. And they said, well, we have to apply by federal law. And basically their answer was, don't ask, don't tell. Because they just didn't have a policy. They didn't have laws that they could use to protect me. Even though I'm a productive worker, you know, on the periods of time when I'm not taking treatment, I'm at work. I never ever use cannabis while at work. It's just not something I would ever do. And yet I'm now in this nether space where it could be used as a reason to fire me. You know, the #1 cause of cancer is stress. The last time I took the chemotherapy and all the time since, all the times before here in Oakland and using cannabis from Harborside, not only have I not vomited, but I've been able to sleep through the night. You know, my normal regimen would be that 2 hours before I took my chemotherapy, which was, I would normally take it at 11 o'clock at night, I would eat a portion of a cannabis brownie that I would get from Harborside. I would take my chemotherapy 2 hours later and fall asleep about a half hour later, and I'd wake up in the morning and I would feel well. And compare that to waking up vomiting in the middle of the night, or potentially not even being able to keep the chemotherapy in my system more than 10 minutes, the probability of my survival dramatically changes.